A big week in the race for a COVID-19 vaccine gets capped off with the first company filing for an emergency use authorization. Officials say distribution of Pfizer's vaccine could begin within 24 hours of authorization. Sarah Daloff has the details.
After months of work,
this is a historic day.
Pfizer and BioNTech now submitting their vaccine for emergency use authorization, one they say was nearly 95% effective in trials. Moderna reporting similar rates in the one it's developing.
Give us great hope. It's the equivalent of a medical home run, maybe a grand slam.
The FDA will analyze Pfizer's raw clinical and manufacturing data, a process that's expected to culminate with an advisory committee meeting in December.
We need to put to rest any concept that this was rushed in an inappropriate way. This is really solid.
Meanwhile, Oxford University and AstraZeneca releasing new preliminary data from their phase 2 trial, showing promising results in young and older adults. The news coming at a critical time, with more than 193,000 people reporting new COVID-19 infections in the U.S. Thursday, a new record. 1 in 5 hospitals nationwide reporting staffing shortages and long lines at testing centers like Dodger Stadium.
There is an ominous feeling for many of us here that we're going to have to go through some measure of what we've already gone through once before.
States implementing new restrictions, a limited stay-at-home order for most of California, more than a dozen Colorado counties shuttering indoor dining. The CDC advising Americans to play it safe ahead of the holidays.
Wear a mask, watch your distance, wash your hands, stay home.
Skipping traditional Thanksgiving celebrations to ensure loved ones are still healthy come Christmas.
The World Health Organization is now recommending against the use of the antiviral drug Remdesivir for COVID-19 patients in the hospital. The WHO says there is no evidence the drug improves survival or shortens recovery time. The recommendation stands in stark contrast to that of the U.S. Food and Drug Administration. Remdesivir is the first and only drug approved in this country to treat the coronavirus. New data from the CDC suggests masks really do help prevent the spread of COVID-19. The study focused on the state of Kansas, where the governor issued a mask mandate on July 3rd. 81 counties opted out of that mandate. Researchers found in the 24 counties that did require masks, COVID-19 cases decreased by 6% over the next 6 weeks. But in places without the mandate, cases increased by 100%.